Okay, so I'm Alex, and I'm in Greece right now. This is Courtney, my colleague and journalist, who is in the United States. Where
Hi,
about,
Alex.
Courtney? Illinois.
Yes, I'm in Decatur, Illinois. It's about 3.5 hours south of Chicago.
We've all left from the United Kingdom after the coronavirus pandemic and the closure of our university. So, Courtney, what's the situation like there in the US right now in general?
So, right now in the US, we have over 311,000 cases all across the US. Most of those are in New York State, and New Jersey. Currently, we have over 9,000 deaths in the US. Um, my state right now has more than 10,000 cases, and we were the second state to do the shelter in place initiative.
Ah, okay. Are there any differences, specific differences in the restrictions as imposed by the law of different states and different governors? Are there any differences, significant differences?
Yeah, so right now it's important to know that for the United States, there isn't a federal mandate. So the United States government federally is giving out advice to states, but really it's coming down to the governors per state. So California was the first state to do shelter in place, which means that they were the first state to really shut down all the bars and the restaurants and the pubs, but then they took it a step further by really recommending that people stay home, which is where the shelter in place came in.
Mhm.
Illinois was the second state to do that. Currently, as of right now, there are 41 states who have a shelter in place goal or initiative or whatever you want to call it. Other states are only locking down based upon region. So basically, some states are doing it where they're not shut down all across the board, but instead specific counties have been really shut down. And then there are still some states that don't have any restrictions at all.
Any restrictions at all?
Mm-mm. Yeah,
So,
and
so,
those are
so
the
people
states.
just walk out actually like being a regular day.
Yeah, and so states like Montana, for example, I don't think that they have any restrictions right now at the moment. Let me just double check that, but
Mhm.
they don't have any. Yeah, so like North Dakota right now, they don't have any restrictions, and they're a state where their population is lower, so I think that plays a big part in it. But as of right now, they don't have any restrictions, and so they might if they get more cases or if a federal mandate goes into place, but I don't know when they're going to put restrictions in place.
Okay, so I've heard some messages that Donald Trump delivered, and they were kind of confusing. So there wasn't one single message across the United States that will include all the states of how you will battle, how you will encounter the virus. Was or was not one single message from the president?
Yeah, so I think a couple of weeks ago they had started to say, states should be putting restrictions in place. And then a couple of days later, he came back and said, okay, we're thinking that all of those restrictions will be lifted by Easter, even though the numbers and the spread of the virus weren't really showing that. And then a couple of days after that, it seemed like the messaging was a lot more strict again in terms of saying the next 2 weeks will be the hardest. So it seems like federally, from President Trump, there has been some back and forth between the messages. And so even right now, he was saying, restrictions will need to be kept in place for a long time, as the next 2 weeks will be some of the hardest for the US, except then he was maybe calling for there to be a lift in some restrictions for Easter Sunday still. So even right now, we're seeing some conflicting messages. But I think that at this point, the governors are each kind of doing their own thing. And I think that the governors will
Mhm.
continue to keep the restrictions in place. The CDC just yesterday announced that most people who go out to the store should be wearing a mask and gloves at all time, whereas before that wasn't really the advice that was being given out by the federal government. And so it's
Is it
not being
imposed? Is it
enforced though.
imposed? Is it
It's
imposed
not
to wear?
enforced.
Ah,
It's voluntary.
so it's like a guidance, like a
It's
pattern.
yeah, it's guidance.
Okay. I think almost 800 people died yesterday in New York alone.
Mhm.
You said that right now, the state of New York has most of the cases.
Hmm.
Do you think people receive it differently across the states? What would you say about your collective responsibility, the feeling of collective responsibility? Because, for example, here in Greece, where I'm right now, we have a curfew going on,
Hmm.
and that's to be shared by everyone. We all
Hmm.
pay our respect to that. We follow with the same line, the same track on
Hmm.
that. So, what would you say about the collective responsibility there in the US? Can you trace collective responsibility in Illinois, for example?
Yeah, I feel personally like collective responsibility is harder to trace in the US just because I feel more than most people in our country is just so large. But I would say that just going out and about yesterday, I went over to my grandfather's house, and as we were driving over there, I saw a lot of people either in mass or in their own cars or in mass as they were walking into the grocery store. And so I think it just depends on who you are. I've talked to some people who think that this is all being overblown, and then I've talked to other Americans who totally agree with all of the restrictions and agree that this is a huge pandemic, a huge issue. So I think it comes down more to your personal belief for how serious this all is. As far as I know, people are trying to take it seriously though, because they are worried. Everyone knows someone who's older, someone who has an underlying condition. So I think that a lot of people are taking it seriously and trying to prevent the spread of any type of infection.
Yes. So they are just, you mean, self-isolating and restricted only to their
Yeah.
basic needs. They go out
Yeah.
to cover only basic needs. But there are some
Yeah.
others who you think do not take it so seriously. And maybe,
Yeah.
is there anyone who you think, or anyone that disagree with this thinking, with these kind of thoughts about going out and, you know,
Yeah. Well, my own grandfather yesterday, he's 87, and we were over there and we were keeping social distance. We had him sitting on one side of the room. We had brought him groceries. He kept trying to move closer, trying to take the groceries before we had the chance to wipe them off. And he himself said, like, oh, if one of the restaurants were open in town, I would probably be there,
mm,
despite the worries about the virus. So I think that there are some people, especially like him, who lives alone and someone who's older. I don't know if it just comes down because he is living alone, so he's struggling with the isolation. And then there are certainly some people too who, they feel like the U.S. economy, we could just let the older population pass away, and maybe people with underlying conditions pass away, and we could take our chances. There are some people who feel like the restrictions are overblown, and we could just take our chances with allowing the economy to come back to normal. But I think that right now, the percentage of people who feel that way are far less.
that is good. That is good.
Yeah.
Because human lives are above the economy and any other thing that could be there.
Yeah.
Yeah, and it's not only about people with about the elderly and people with underlying problems. For example, a 17 years old, I think, 17 years old, died in LA the other days,
Hmm.
who was not sick or anything, didn't have any underlying conditions, underlying
Hmm.
problems to the virus. So yeah, I think it's not about, it's protecting everyone,
Hmm.
everyone who is to be
Yeah.
protected.
Yeah. In Illinois, we had a 2-year-old pass away last week,
2 year
and
old
yeah, a
with
toddler.
underlying problems, with
I don't
underlying
know that.
problems.
I couldn't find that out whenever I saw the announcement, but it's still
Okay.
so young.
Do you have any statements from the opposition party concerning with the government's policy towards the virus?
You mean, do I have
If
anything
the
about?
Yeah, if the opposition party suggests something different in what's
Mm,
being done.
well, yeah, I think personally, so I thought it was a good move by Donald Trump personally whenever he shut down travel from China pretty early
Mm.
on, and the opposition
And
party, the
from Europe
Democrats.
afterwards. I think
Yes,
he's starting out. Yeah.
yeah, about a month later he did it from the EU. So I thought that was a good move on his part, but at the time, the opposition party, the Democrats, were saying, this is too much. This is a racist move since we were blocking travel from China.
Mm.
So that was something that I felt like was wrong on their part. And then about a month later, he blocked travel from the EU, and he did not block travel from England and from Ireland, which I thought was interesting because some countries in the EU only had a couple of cases at the time, but England and Ireland, I mean, England had 248 cases whenever he was blocking travel from the EU. So it didn't really make sense to me for that decision. I think that was a good move, but I think it was probably just done, too late. In hindsight, it seems like we just needed to ramp up testing a lot sooner. So something that I kind of wish that President Trump would have done is I wish that he would have enacted the Defense Production Act to ramp up testing earlier on and to also ramp up the production of ventilators and masks and gloves and gowns.
Yes, I saw that too.
Yeah.
Do they say any statement about the peak of the virus? When do you expect the peak in the US in general?
So the problem with the US is that we are so large as a country that we are going to be having a bunch of different peaks at different times. That's what they're saying. So, for example, they think that the peak in New York might be in the next 7 days, but they think that the peak in New Orleans and Louisiana might not be for another 2.5 weeks as a result of Mardi Gras, which took place a couple weeks ago. They think that the peaks in Florida, because of spring break, might not take place for another 3 weeks. So I
it
think
could be
that in the
different.
US, yeah. And so I think right now, what a lot of Democrats are calling for would be a federal mandate to shut down, because Florida had only shut down things regionally, even last week, despite having all the spring breakers. So then you have people coming from all across the country to Florida, and everyone then leaving and going back. So I think you're also seeing some hot spots pop up based on young people spreading it back across the country.
Okay. Well, I hope everything will go according to plan. I mean, what else can we do? The president also said that something about, which was tragic in a sense, that if the death toll remains under 100,000 or between 100,000 and 200,000 people, then he would be like a success. That would be a success, which is, out of the question. But who knows when this will finish?
I know. Yeah, I'm hoping. I mean, I would hope that number is kind of overblown and that we could keep it far below that. But with the way that things are moving so quickly right now, I'm not sure that we will be able to. And I think that some things right now we were putting off. I think that we were putting off closing down certain states or locking down certain states. And I think that we were putting off using the Defense Production Act and things like that. But I think that it will become a matter of not if we have to do those things, but it will become a matter of when. So I think some things we haven't done yet, but I think that we ultimately will. But that's more of a pessimistic view than what some people have.
Yes. Do you feel safer now in the US, in the state of Illinois, compared to the United Kingdom, where we were before?
I don't really feel safer in one place or the other. I mean, I guess technically I could be safer here because we can drive to most places versus walking around. I have not gone since this is still the 2 weeks. I have not gone into any store since I've been back. I feel like I would have been safe in either place. Like if I were to have to go to the hospital, I would feel safe in either place. I think the difference is here, it is just my home is bigger than my flat in the UK. So, it just is a little bit better for me to be here with my family. But I didn't.
Self-isolation, always better if you have a bigger room.
Yeah, but I didn't leave the UK because I felt unsafe.
Only one person of your family goes out to cover the basic needs, like do the shopping and stuff. Only one of you.
Or my mom and my dad have been going out. They've been trading off and on.
Oh, okay.
Yeah, they've been wearing gloves when they go out. I think now they've started to wear masks as well.
Okay, thanks for today, Courtney. I hope you will be safe, and I hope everything will go as planned there.
Thank you. You too.
in the US. Bye-bye.
Bye.